Now we're going to move into the panel discussion that Sheba referred to about childcare. And, I guess it seems surprising that the impact of childcare has been somewhat hidden on our economy, and certainly was thrust into the white hot spotlight during COVID. So we're very happy to have a panel discussion today of people that are really appropriate, thoughtful, smart partners in this area to help us understand what kind of impact it is having in our community. Our moderator for the panel is Ananda Sweet. She is the Vice President of Public Policy and Workforce Development at the Santa Rosa Metro Chamber, and she's also serving as the chair of the Sonoma County Workforce Investment Board. When I asked Ananda to share with me the art that has inspired her over this past year, she pointed to the public program Open and Out in downtown Santa Rosa on 4th Street, where Santa Rosa hired 50 local artists to incorporate art into those temporary business spaces on alleys and sidewalks and streets in Santa Rosa. And as it happens, that project was funded by Creative Sonoma. So thank you, Ananda, for the opportunity to give a plug to the program. And I'll just mention that it's also occurring not just in Santa Rosa, but in 5 of our other communities, and was a great joy to be able to bring art into the reopening conversation. So with that, welcome, Ananda.
Great. Thank you so much, Kristen. Childcare accessibility has been a problem in Sonoma County that existed pre-COVID-19. The need for childcare solutions has only further increased in the last 10 months. The issue is far-reaching and impacts our community as a whole. To further discuss this topic, we're joined this morning by childcare policy professionals and advocates, Melanie Dodson, Executive Director of Community Childcare Council of Sonoma County, better known as 4Cs, and Angie Dillion-Shore, Executive Director of First 5 Sonoma County. But first, I'd like to address this question, as we often don't think about childcare and the economy in the same space. Why is this issue important, even to those of us not directly impacted by childcare needs? The data is clear. We all benefit from investments in childcare. There's a clear business case for investing in quality early education and care. Parents rely on childcare to help them enter, re-enter, or remain in the workforce. Before COVID-19 and related school closures, half of the workforce missed 8 days of work per year due to childcare issues. And 80% of parents would leave their current job for another that provided childcare. Employers who invest in on-site or near-site care find tremendous returns on that investment in the form of tax write-offs and credits, increased productivity, enormous positive impacts to retention and ease recruitment, as well as improved company culture, community image, teamwork, gender parity, and more. Beyond the immediate workforce demand, childcare is a 2-generation workforce issue. It's essential to support our workforce of today and vital to develop our workforce of tomorrow. Looking at the case for a public investment in childcare, investments in childcare bring a higher return to the community than the stock market. We know that 90% of all brain development occurs before age 5. And comprehensive studies by economists cite anywhere from a $7 return to more than $20 return for every dollar invested in an early childhood education, a range depending on outcomes studied and who's served. This return comes from savings in special education and remediation, better health outcomes, reduced need for social services, lower criminal justice costs, and increased self-sufficiency and productivity of families. Let's look at just one of these ROI factors, incarceration rate. There is an undeniable relationship between early childcare, reading ability, and incarceration. Research shows that participation in high-quality early care and education programs increase children's language and literacy skills before they enter school. A child's learning from birth to age 5 determines his or her kindergarten starting point. And children who start kindergarten with grade-level skills start ahead and they stay ahead. Children who participate in high-quality preschool programs are 40% less likely to drop out of school. And those students are 63 times more likely to be incarcerated, according to a long-term study. In addition to the costs of incarceration, this impact to high school graduation rates alone is, of course, a major workforce issue. I'm sure we can all agree that all children deserve access to early learning opportunities that will increase their chances for success in life. And beyond it being the right thing to do, it's one of the most important investments we can make for a strong economy. To better understand the childcare crisis, impact, and opportunities, we'll go to our panelists. Melanie, what have historically been the biggest challenges for childcare in Sonoma County?
There we go. Thank you. Good morning, unmuted. Yeah, so historical challenges in early education and childcare. I am also trying to move my slide. Here we go. So I think there's quite a few things that historically have impacted childcare. And to Supervisor Hopkins' point about thinking forward, we kind of need to look back to see the structure of this industry. So this slide shows the many different words that are associated with our field: preschool, childcare, early learning and care. It is a very complex system. It's a mixed delivery system, and there are absolutely strengths and challenges within that system. Many of the strengths include options for parents, that they can find something that's culturally appropriate and something that they are looking for their very young children. But many of the challenges in a mixed delivery system is how complex it is, and it's not straightforward, and it's not easy to navigate for parents or our community or our partners to understand and ask, why is it so complex? Our industry has over 5,000 individuals who are working in some aspect of this. This is from center-based programs, licensed family childcare homes, family friend and neighbor caregivers who are doing care for their family. There's cooks, janitors, administration. It's very complex. It's funded not only publicly by both federal dollars through the Head Start program, state dollars through state-funded preschool and voucher programs, and then you have a full tuition or for-profit industry, the private sector, small businesses, some people individually in their home caring for kids, and some larger base centers. So this very complex structure, it really calls out some of the challenges for funding and for understanding and accessing the system. Historically, this has been an industry with low wages. When childcare started long ago, many women were going into the workforce because their husbands were going to war. So when they were on the battlefield, women needed someone for their children to go so they could provide for their families. So an industry that is predominantly women, and particularly now women of color, and has historically had low wages because moms don't get paid necessarily for taking care of their children. So we start with that. And that it's not always seen as education, even though we know children never stop learning. They're learning from the moment they're born, and they don't start learning when they show up in kindergarten. So that early education versus childcare versus preschool connotation definitely impacts the wages. Wages in our industry are barely meeting minimum wage in some cases and slightly just above. So it's very difficult to make a living. And this is folks with their degrees. Access and affordability has always been an issue for childcare and early education, whether the facilities are available, where the childcare program, early learning program is located, and then how much does it cost? The cost of care these days, particularly with a little bit of a COVID bump, is anywhere between $13,000 to $19,000 a year for our birth to 5. It's like it equally compares to a college education these days. So many families, that is not an option for them in their budget, especially in a high-cost community like Sonoma County. In addition to access and affordability, we look at our business sustainability of our small businesses. This is not an industry that you can make more of something to make more income, to pay your staff more. You have to set rates that your parents can afford, because your parents are working here in Sonoma County as well. So it's very challenging because the majority of all costs for our childcare early learning businesses are staff and facilities. So very challenging when you're talking about potentially $19,000 a year for infant care full-time, then to still not be able to fully pay your teachers at a minimum wage, let alone a living wage for Sonoma County. Of course, now historically here in Sonoma County, disasters have really exacerbated the challenge. All of these things I've talked about were an issue before 2017. Now, since 2017 and the wildfires, we lost 14 facilities in Sonoma County during the wildfires, Tubbs Fire. We've had power safety shutoffs. We've had the Kincaid fire, now the Glass fire, and a pandemic. I'll get into the data in a little bit, but all of these disasters had just exacerbated the access and affordability of early learning programs to our community.
That is quite a list, but really important, that we understand those challenges. Angie, what would you say is the root cause of some of these challenges?
Thanks, Ananda. Good morning, everybody. I think we can't emphasize enough, Melanie touched on that longer term history around childcare, not just in Sonoma County, but in our society. It is a really critical context to understand because it underlies almost all of those challenges that Melanie described, right, around access and affordability, directly related to the causes of those challenges, and also creates barriers, makes it really difficult to solve those problems. So I want to elevate this. The care of our very young children obviously is traditionally, historically, and still very much has been up to women, right? Mothers, grandmas, aunts, nursemaids, nannies. And then when moms were involved in the war effort in the 40s and then really entered the workforce en masse, we started to create systems, right? So that someone other than a family member provides the care. And we see consistently throughout the decades up until now, providers of childcare continue to be poorly paid and disproportionately women of color. Even as the field of ECE has been professionalized, we now have standards, licensing, credentialing, robust academic research that really proves the value of ECE, right? Yet providers of early care and education continue to be severely undercompensated. The system overall is underfunded and precarious. Hence, we see all of these businesses closing during the pandemic. It just doesn't pencil out. And so the work is just undervalued on a societal level even still. And at the same time, entities beyond the sector that Melanie and I work in have fully embraced how critical high quality ECE is for child development and all those other benefits. And Ananda gave talking points today as our local Chamber of Commerce. That's a great example of how, our local business community, many folks are champions of ECE. But the gender and race inequity and the bias that underlies the undervaluing is still deeply entrenched, and it's built into our systems and the policies that drive how childcare is funded, how it's licensed, how it's legislated, how it's budgeted at the state and federal levels. So we have to persistently and actively address this structural bias and center equity as a driver to the overall set of solutions.
Thank you for that insight, Angie. I think it's really important that we understand not just the challenges, but the root causes as we work on solutions as a community. Melanie, roughly how many slots did we lose during the pandemic?
Great. Yeah, I will start with some facility data. So this first slide shows pre-COVID, we had 608 childcare early learning facilities across Sonoma County. Many of you may know there's 2 childcare resource and referrals in Sonoma County, both 4Cs and River to Coast Children's Services. So we work closely with them to make sure we're inclusive of the entire county. Currently, we have 396 of those facilities open and serving children. And under COVID requirements, we can only serve up to 16 individuals in any classroom, and that includes teachers. So many of those classrooms have only 12 in them. So you can see we have 43% of facilities that were in business in March 2020 are currently inactive. That they may come back to us, but we don't know if they will survive during this time. And we have 7% of our facilities that are currently closed. When you translate these facility numbers into actual slots, so since March 2020, we have lost as a county 57% of all of our early learning and childcare slots. And again, when I say early learning, childcare, preschool, they are all the same. It is any time a child that is birthed through school age of up to 13 years old is not in the traditional K-12 public school system. So this is infant, toddler, preschool, and school age students. So this is the loss of slots that we have seen. We currently have, again, 5,518 slots. So that is greatly reduced. The other interesting data point here to share is that obviously some families can afford slots and some do not. We host a waiting list for any family who's looking for care and needs assistance in support to pay for that care. We continuously have right now there's 1,493 on that list for children. That is a consistent number, and I do believe that that number is underestimated because there are many more families, particularly now, that have need. So there's not enough slots out there. We need to make sure we can support those programs that are inactive to become active again once COVID is moving forward and folks are vaccinated, and as businesses reopen, and they'll need these slots for those, their families, their employees to come back for their children to have care.
Thank you, Melanie. Angie, how can we avoid this loss in a future crisis? Are there opportunities now?
Yeah, there are some really important opportunities for advocacy, both at the state and federal policy levels. Investments in early care and education that have the potential to really strengthen the field over the long term, address some of the severe inequities that could make the field more sustainable, less vulnerable to the kind of crisis we're experiencing now. But first and foremost, the most important thing, and this is the position of most economic experts, the entire ECE industry just nationally needs a federal bailout to address the impacts of the pandemic. What's happening, the data that Melanie just showed is happening in every community, in every state across the whole country. And this includes private childcare centers and home-based providers, in addition to government-funded childcare programs like the preschools that Melanie's organization runs, Head Start. Those kinds of programs are receiving adequate supports for the most part to prevent them from failing, but we also need to ensure those private childcare businesses get relief, or there will be no childcare for moderate and high earning parents when we get to the other side of the pandemic. So President Biden has outlined a sweeping plan to address the impacts of the pandemic through the stimulus package that's been proposed. That includes a $25 billion emergency stabilization fund to help child care providers stay afloat, including private providers, as well as an additional $15 billion to support subsidized programs. So this is critical that this is passed by Congress. On the state level, the governor's budget proposal includes $300 million in one-time investments to address the impacts of the pandemic on childcare. It expands slots for school-age kids, extends childcare for children of essential workers, at-risk children, children with disabilities, as well as stipends to help providers reopen that are currently closed as a result of COVID-19. And this is funded by the December 2020 federal COVID relief bill. The governor's budget also proposes to make what he refers to as a down payment on universal preschool by funding the expansion of transitional kindergarten, also known as TK, to include all 4-year-olds. But this strategy is very contingent on a strong commitment from our school districts to that high quality, developmentally appropriate transitional kindergarten and partnerships with the childcare sector, because TK is not a full day program and working parents typically need a full day care. And then the other piece of the puzzle, just to uplift, is that when we talk about the ECE system, this includes supporting parents to be their child's first and most important caregiver, advocate, teacher, everything that they need to be. So we do need to expand investments in paid family leave, employers promoting family-friendly workplaces and flexible scheduling. All of these things that we haven't even addressed today really are an important part of the overall solution.
Thank you, Angie. And Melanie, what local efforts and opportunities should we know about?
There is such amazing work going on here in Sonoma County. It is truly partnership and local investments that have really made a difference in preserving what we have and are going to be critical moving forward. So a few examples of types of partnerships we have locally. I think one is very clear that our Santa Rosa Metro Chamber has been a leader in supporting employer-supported childcare, hosting quarterly meetings to inform and educate our employers about opportunities and connecting them with the early learning childcare field with providers who might be able to support. There's a lot more work to do there. There's a lot more conversations to be had. Things will shift after COVID. So I think we continue those conversations. We invite more and more people to the table. We help spread this knowledge across the county and this thinking, because I think together we really can make a difference and support the industry and our parents and our businesses. The city of Santa Rosa has made direct investments into childcare very recently. They have helped to establish a childcare resiliency fund along with the Community Foundation and First Five Sonoma County to support providers with small grants during this time, which has just been critical. They've also invested in the Childcare Initiative Project, which is run by 4Cs. One long-term vision we have is how do we build more childcare and get people to work? Families who are already caring for children in their home can become licensed and do care in their home. And 4Cs now trains folks across the county to do that work. Little child care incubator program. Many of our school districts are the most amazing partners. Many of our programs are on school district campuses, both preschool and school age aftercare programs. The access to facilities, these partnerships and relationships, the visions that our school district partners have of pre-K to college support for their students is exactly where we need to be. We need to think even further into that infant toddler realm because we can't leave them out. And I think just the ongoing advocacy and the understanding of our community and opportunities like this and forums like this, where we elevate this topic to one of the most important things that we can do for our parents, as employees, and as business partners in our community here in Sonoma County, will really take us to the next level in early learning and make sure our children get exactly what they need.
Thank you so much. Listening to you both, I think it really highlights the silver lining, of what we're experiencing, that, hearing, the collaboration that's happening locally that we've just never seen before in terms of cross-sector collaboration and efforts to increase access to childcare, and then, resources coming in as sort of a shared understanding through our experience of the pandemic, nationally of, what happens when people don't have access to childcare and how essential it really is to all of us. With that, thank you so much, Angie Dillion-Shore, Executive Director of First Five Sonoma County, Melanie Dodson, Executive Director of 4Cs. The three of us would be more than happy to answer any other questions you have or talk about how we can work together on this issue. So please don't hesitate to reach out. I see that our contact slide is up now. Thank you so much.
Thank you, Ananda and Melanie and Angie, for a terrific conversation and for helping us recalibrate our thinking about the central place that childcare, access to childcare has in our economy, certainly in recovery, but also in going forward. We really appreciate it. And as was mentioned, we're going to ask folks that have questions for this panel to send their questions to them directly via email, which you see on the screen, and those emails will also be posted. And now we're going to